Welcome, everyone, to another segment of our Ageless Beauty Summit, where I pick the brains of experts on all facets of healthy aging. Today, I have a surprise for you because I've advertised this show to be 21 Wise Women. And as you can see, there is also one wise man with us today. But before we get started, I need to tell you all something. This summit, thanks to you, has gone global. The only continent I haven't heard a peep out of is Antarctica. Interestingly, I have had significant feedback, though, from everyone asking, among other things, about brain health and brain disease, because clearly this is an aspect of aging that has enormous impact on the quality of our aging experience. The only person I trust to answer these questions is Dr. Trevor Berry. Say hello to our viewers, Dr. Berry.
Hello, viewers, and thanks for having me, Janet. I'm excited about this opportunity. And I feel privileged. I get to be the only male on so far, but I'll have to try and live up to the wise part.
Well, I am so honored to have you here with us because I know that with your information, we will also receive your honesty, clarity, and perspective on brain health.
I will
So our
definitely do
viewers
that.
already know that I'm 62, but I've been treated by you, Dr. Berry, since I was in my mid-40s. Do you realize that?
Well, you haven't aged at all, so obviously you're living what you're preaching here. So
I went back and checked because I know it had been a long time. But back in my mid-40s, I had started bodybuilding, and bodybuilders regularly push themselves beyond what is considered normal. And that's why we look the way we do. But underneath the shiny exterior, things do go wrong sometimes. And these are some of the things that Dr. Berry has fixed on me: frozen shoulder, vertigo, back spasms, routine spine adjustments, and there's more. So I have challenged and annoyed Dr. Berry for almost 20 years. So why has he been my secret weapon? He's a chiropractic doctor and a functional neurologist. So the understanding of the human nervous system is rapidly evolving. And Dr. Berry spends hundreds of hours every year traveling to conferences, reading peer-reviewed literature and research to stay on the cutting edge of diagnostic and treatment strategies. How many of you out there, a show of hands, yes, I can see you, have ever gone to the doctor for pain and come away still not okay? There's still a lot of hands up, Dr. Berry. To tell you the truth, many healthcare providers have not even heard of clinical applications and advancements in treatment provided by functional neurologists. Dr. Berry has over 2,000 hours of postdoctoral education in neurological fields such as vestibular and balance disorders, traumatic brain injury, pain management, and neurodegenerative disorders, as well as functional medicine. So, Dr. Berry, I could probably go on talking about you for the rest of the 30 minutes. But you've told me your mission. And to be fair to our viewers, I would argue it is your obsessive passion to never stop learning about the human brain and body from every angle possible. And it makes your treatment seem like magic because it fixes where others fail. So I have to ask you this to start with. You went to school to become a chiropractor, graduating with the highest honors and accolades. Tell us why that wasn't enough.
Well, I think in my field in particular is that with chiropractic, it's really that it's a neurologically based entity. So there was a lot of things that I either had heard or read about or saw in our clinical experience in school that said chiropractors can help with X, Y, and Z. It may have been things like we know that chiropractic care can lower blood pressure, that it can help with headaches, or all these different things. But like many of the healthcare fields, some of the teaching behind that was either outdated, anecdotal, things like that. And that didn't sit well with me. I'm one of those people that I want to know exactly why. When I do this to a patient, what is happening with their nervous system and their physiology, and why is it happening, and how, that gives us those end stage outcomes. And so it actually drove me to dive deeper into the field of the study of neurology. So that helped piece some of those missing links together. And So now when I do stuff with patients, I can help, describe, hey, when I do this to your body for this particular reason, this is what is most likely happening with your nervous system. And this is why, say, the room's not spinning anymore. This is why you don't have mental fog or, brain fog anymore, things like that, and really just map it out for them so they have a true understanding. Because I think that's another big thing that physicians aren't doing as much anymore, is educating our patients. I know you kind of joke with me that you bug me and that kind of stuff, but I love that you are inquisitive. You ask questions, you're your own advocate. And so you do a really good job, as I implore all patients to actually really understand and dig deeper with their doctors as to why they're getting these therapies, whether it's a medication, vestibular therapy, a nutrition, whatever it is. Understand why, and don't just follow the word as gospel. Really get the doctors to explain it. And unfortunately, I think that's kind of a dying breed for physicians, whether it's time constraints, practice manage or managed care limitations, things like that. So there's a lot of reasons why that I can go into, but so it's really about answering the root cause and getting to the root cause of problems. And really, at the end of the day, the brain and central nervous system is the end all be all. If you don't have a healthy central nervous system, you can't have a healthy body. It's as simple as that.
Yeah, it seems like that is probably one of the key bits of advice for everyone listening, is to be your own advocate. And it's not like you're doubting anything. It's really, you just want to understand how your own body works and why. And also it makes it easier to work along with the care you're getting, so that you know why you're being instructed to do certain things and not do other things, so that you can have a better healing experience too.
Exactly.
Well, many of our viewers are interested, and I would say worried, about brain disease. The tone of people who wrote to me it's been more concerned because they have a family member. They realize they have a family member or an ancestor who had a problem with Alzheimer's or dementia or some kind of other brain disease, maybe Parkinson's. And we know enough to know that there is a genetic component to some degree, but we're also told that genetics is only a small part of who we are, and that lifestyle does have a huge influence on how we age. But it seems like dementia, from what I'm reading, it's like, it seems to be more prevalent than ever. I hear more about it, maybe because I'm paying more attention to that. But tell us a little bit, is it genetic? Is it lifestyle caused? If it's genetic, is a healthy lifestyle enough to head it off? Talk a little bit about that.
Oh, definitely. And that's a great question. To your point, when we all have genetic predilection, or gene SNPs is what they're called. And what that means is that we all have faulty genes in our system. Now, what your audience has to understand is that just because you have a genetic predilection does not mean that it's going to phenotypically express itself. And what that means is that you can have faulty genes, but it doesn't necessarily have to manifest in disease or symptoms. And so then you have to look at, okay, yes, there are certain genetic predisposing factors. There's terms like ApoE4 and PSEN1 and whatnot. Those are those fancy genetic terms. But what the research shows with people like Tansey out of Harvard, for example, say that there are definitely epigenetic tripwires that will push you off the cliff. And in particular with Alzheimer's, one of the big final tripwires that we're seeing that's really pushing that, making that genetic expression express itself, is inflammation. Inflammation of the brain is one of the big things that they're showing in research that actually pushes people into, down that path. Now, the big question there becomes, well, what are all the things that can cause inflammation of the brain? And we're definitely going to touch on some of that stuff tonight, because it's such an important thing that people understand, that they may not even realize that they're shooting themselves in the foot with some of these inflammatory situations or causes.
Mm-hmm. So, because I know that most people in our modern society do inflammatory things to themselves, whether it's diet or beverage or recreational drugs or stress or overtraining even, or, I mean, I could go on. There's many things. And yet some people go all the way through their whole life with those things in their life and don't get Alzheimer's. So it doesn't always happen. So is it because the person has that trigger all just kind of set, already in their genetics, and they have the behaviors together that sets it off?
Yeah, it's a multifaceted, multifactorial problem that we deal with. So going back to your question about the dietary and other triggers, what we have to understand is this, is that Alzheimer's like dementia. Dementia is kind of your all-encompassing neurodegeneration in that realm. Alzheimer's is the most common. It really is a disease of Western lifestyle. The first thing that we look at is the amount of sugar this country consumes. Mm-hmm. Sugar will start to, the plaquing that blocks the neurons from talking to each other, that communication. Sugar actually gunks up the neurons. It's called amyloid beta plaquing. And a lot of researchers will actually call Alzheimer's type 3 diabetes because of the amount that sugar comes into play. So that's an interesting point that, the World Health Organization, when they got together early in the 70s, I would recommend everyone watch the documentary Fed Up. But if you look at things like the McGovern report and whatnot, we're only supposed to have 9 grams of sugar a day. One soda has some of them have 36 grams or more. Right. And so if you think about that, you're having over 4 times your allotment of daily sugar intake with just one can of soda, let alone all of our other sugar sources. Mm-hmm. Our omega-3 ratios. This country, we love our alpha linoleic acids. We love our potato chips and salad dressing and chicken wings and all these things of these kind of fats that aren't good for the brain, and we don't get enough of the good, fish oils and things like that. So that's another major player, and that's one of the big things that's very neuroprotective is your omega-3 ratios. I cannot state enough, if you can get your omega-6 to 3 ratio down to a 4 to 1, you will have a 70% reduction in all-cause mortality. So if you think about it, that's astronomical. So, and the dietary stuff, the way I describe it to my patients is whatever we put in our mouth is either killing us or healing us. Okay. And our food industry is not doing us any favors. I'm going to pick on them for a bit because they don't care. They just want you to eat, become addicted to it, those kind of things. Mm-hmm. It's not in their best interest. And if it doesn't sell, then it's the bottom line is their bottom line. So what we have to watch for is certain foods that we consume regularly that may be neurodegenerative or traumatizing, if you will. A good example of that is our NMDA excitotoxicity agents. So don't worry about those big terms, but there's a certain receptor in our brain neurons that gets opened up too long and can either kill off the neuron or make faulty proteins, which is another big precursor for neurodegeneration. And 2 of those major chemicals are monosodium glutamate, or many of your audience knows it as MSGs, yes. And the other one is aspartame. So all of your diet product stuff, your diet sodas, your low calorie, things like that. And what the food industry did was because the people were getting smart about avoiding MSGs. So then what did they do is they labeled it with 30 different names. So we have to be very smart as consumers that we're not consuming diet products or monosodium glutamate products, because in essence, in short, that's just basically blowing up neurons in your brain. It's a process called apoptosis. So we really need to watch those types of food sources, because the way I describe it, when you drink or eat those types of products, you're basically chemically concussing your brain every time. And that's why studies of people that consume diet products, they have higher rates of neurodegeneration like dementia. They have higher rates of stroke and whatnot. So we cannot consume, we just need to avoid those foods at all costs. On the flip side, when people ask me, well, what diet should I have? There's no such thing as a good diet. You know that. I know you talked to your client. Yeah, exactly. We need to eat what Mother Nature gave us. Mm-hmm. Did Mother Nature give us genetically modified or genetically engineered food? No. Did Mother Nature give us aspartame? No. Did I could go on and on. So what people's diet should be is what we can forage, hunting, gathering, that kind of stuff. That's what we want to consume. We want good natural vegetable products as the core. But it's okay. The brain needs red meat. It just needs it to be grass-fed, grass-finished, not full of antibiotics, not full of genetically modified corn and soy, consumption and whatnot. That's what makes those things inflammatory, carcinogenic, heart unhealthy, things like that. So we want to eat what Mother Nature gave us. And lastly, we don't want to overlook the term fasting. And I don't know if any of your other presenters have talked about that, but fasting is a very neuroprotective thing. it's very good for gut health. As a matter of fact, your gut cells, I don't know if the endocrinologist went over this, but your gut cells turn over about every 3 days. That lining, that protective lining, turns over about every 3 days. So a really good clinical pearl for your audience is the fact that if you really want to hit the reset button for your gut and your immune system down there, is that you want to work up to a 3-day water fast.
Wow.
That can be really hit the reset button. But in that time, when you're fasting, your brain is taking out the garbage as well too. We have a lot of garbage that accumulates up here in all of us, and fasting is an opportunity to take out that garbage. That's why you're hearing more people talk about like not eating after, say, 8 p.m. or, you know, doing the 16-8 time frame where you only eat in an 8-hour span.
Right.
I do a 1-day water fast every 3 weeks just to help my body take out the garbage and that kind of thing. So fasting is a really good tool to use for brain health as well. You had brought up a really good point about stress. Stress is big in this country. And when we are under stress, we release a lot of a hormone called cortisol to go get us glucose to keep up with the stress demands, that fight or flight demand. Well, guess what area of the brain cortisol whacks? It's called the hippocampus. And it's the part of your brain that starts all your memory pathways. You know, that's all, you know, when we start having those senior moments and things, that's the hippocampus. And that area of the brain gets whacked by cortisol. So one of the big things there, take-home point, is the more stress we can get out of our lives, the better it is. Conversely, things like meditation have been shown to actually grow the hippocampus, to grow gray matter in the brain. So those stress reduction, calming type modalities like meditation are very therapeutic for this stuff.
It's fantastic. I got this image of, I've had so many examples of this when I was in corporate life, and stress to the max, really unhealthy. I was so sick. You know, it's kind of like the walking sick. I had the worst time remembering my PIN number or, you know, important little things like that. And I'm sure that had played a part in that. So, okay. So you mentioned a bunch of things. Intermittent fasting is very much out there in the media now in all different forms, different combinations of hours and so on. It's good for bodybuilders. Some bodybuilders do it sometimes. And also people that are into healthy aging and fitness, and have said that it clears their brain fog is the way they describe it. So it sounds like what they're really saying is it cleans up their gut.
Well, and the brain, the little glial cells in the brain, they're often referred as the janitor cells of the brain. When you're fasting, those cells are working really hard to clean up the garbage in the brain as well too. So it's a brain-gut connection there, which we're going to get into tonight because that's a very important thing for brain health. But yes, it really, part of it is that, but part of it is I would not doubt if a lot of people that say that the brain fog is going away and whatnot, they may be consuming foods that's triggering their immune system responses to have that inflammatory mechanism. So sometimes when we take out certain foods, we may not even realize that we're intolerant to. Mm-hmm. Then that allows that inflammation fire to calm down and the brain starts working better because you're taking away those insulting foods that are actually triggering that whole response, which probably is a good segue to go into on some of the things with that. When regards to gut health, there's a big issue that we're seeing as one of the biggest predictors of brain degeneration and brain demise, and even in Parkinson's and whatnot, and that's called leaky gut syndrome or intestinal permeability. So again, a lot of the endocrinologists, if they went over that, it definitely bears repeating, because what happens is when we have leaky gut, stuff gets into our bloodstream that shouldn't be in there. And so our immune system goes into attack mode. And when our immune system goes into attack mode, it uses inflammatory chemicals to do it. Mm-hmm. Now, the problem is those chemicals don't just stop at your gut to fight that fight. They're circulating in your bloodstream. Well, guess where all your blood goes up to? 30% of your blood basically goes to, is utilized by the brain. So when you have all this inflammation in your bloodstream, it's going up into the brain and ticking off the brain, and that's part of that brain inflammation. Mm-hmm. Now, one major thing I have to point out is that the studies show the two biggest, predictors, if you will, or triggers for leaky gut by themselves are bugs like viruses and bacteria and whatnot, but gluten Our Western GMO-based gluten, and when I say actually, let me rephrase that. It's actually the hybridized, deamidated version of our wheat.
Mm-hmm.
And we don't know if it's that deamidation hybridization process or if it's the glyphosates, the Roundup chemical. But that food source is one of our biggest triggers for that leaky gut and intestinal permeability. It's like a Trojan horse that punches a hole through your gut wall, and then all these bad things can start getting in there. So gluten, if when people I don't want the audience to think that this gluten thing is just some passing fad or trend or something. In Western gluten sources, you can go to Italy still and eat it and be fine. Yes. You can go to other countries that have banned, the Roundup and that kind of thing, and probably just fine, in moderation, obviously, like any bread source should be, because it's a carb and that kind of stuff. But the Western version of it, our U.S. version of it, absolutely horrible. We need to educate our patients about that. So.
I agree. I've done a lot of reading about that because of having patients with gluten sensitivity or actual celiac, which is more of an immune, it's like an the allergy is more of an autoimmune thing, whereas the sensitivity is just more like the body says, what is this? I don't even need this. And it doesn't belong here. It was one of the most powerful things that I changed in my diet when I began bodybuilding because of the puffiness. You just get this puffy tummy that won't go down. And even with just one little piece of toast, one little piece of bread. But when you go to Italy, like you said, or any other country, it doesn't have that response. And I've even had a client who came from Bulgaria, immigrated here, and she said, as soon as I got here, the bread made me sick. I mean, she just came out and said it. And yep. She was just so mystified, because bread is supposed to be, the staff of life and all of that, and it's not here. It's not really a food anymore. But isn't it because, okay, you mentioned the Roundup, but it's also the actual gluten, the actual grain kernels have been hybridized to the point where they are far more potent than grandma's bread used to be.
Well, and that's just it. Our great ancestors, they have the digestive enzymes and processes to process, and in a seasonal form that it typically was, those types of foods. The deamidation and hybridization that you reference, our digestive system, our immune system goes, I don't recognize that. Mm-hmm. And now here's one of the problems. Now, you mentioned celiac is autoimmune to the gut lining and that kind of stuff. Yes. The gluten sensitivity stuff, what we're finding is that, like Haji Vasiliu, for example, he's like the godfather of cerebellar ataxia research. He found the biggest research paper ever done on this was 1,500 people over 20 years. They monitored them. And what they found, the number one cause of cerebellar demise or ataxia was gluten, ahead of SCA, like genetics, ahead of alcohol, ahead of all these things. And here's the problem, is that the amino acid sequence of gluten matches your own cerebellar tissue. It's very closely matched to it. And so if you're transglutaminase 6 positive, your immune system tags it. And when it tags it, it's going to look for that sequence anywhere it finds it and go into attack mode when it sees it. Well, guess what? Your own brain tissue is being attacked by your own immune system. And it's another autoimmune example. But anyone with psoriasis, eczema, things like that, that's gluten, usually gluten-based transglutaminase 3 as an example. I could go on about gluten this whole half an hour. We won't do that. But just the take-home point is, yes, get American gluten out of the diet. That's a big one. Dairy is another big one that's inflammatory and whatnot, especially people with the most common autoimmune condition is Hashimoto's, thyroiditis. So hypothyroidism. And it's usually food-based. And the 3 most common foods that trigger it are gluten, dairy, and soy. Right. That's a huge thing for your audience. A lot of females, that are dealing with this, they're not being told that it could be a food-based entity. They're here, just take this thyroid medication. Like, no. You want to measure TPO and TGB antibodies, look at all that autoimmune, fix that side of the equation so that the thyroid even has a fighting chance to stabilize. So.
Right. Yeah. And you mentioned, okay, so if so there's gluten and getting off gluten and dairy and soy, and then stress. You mentioned meditation, and meditation is one of the ways to mitigate the damage from stress and to repair is it the hippocampus that you said?
Yeah.
Yes. And then is there anything else for stress that is besides meditation that you know of that can help with keeping our brains healthy? What if we're in a really stressful job and we're 10 years from retirement and want to hang in there? What do we do?
Well, there's always going to be your balancing outlets. You own the world of one of them, and that's exercise. When we exercise, we do things to help modulate adrenal function and brain control of that and whatnot. So exercise and finding any movement in general. It doesn't just have to be cardio based. It can be gardening, hiking, things like that. The other big thing about that is because we're receptor-based systems, meaning our brain is dictated by what goes in from our body. And movement and muscle activation is the most important predictor of that. So, when we're moving well and moving in general, our brain is actually thriving and growing and making new pathways and whatnot. One thing your audience, I should mention at this point, is that we have to understand that as long as we're living and breathing, we can make new pathways. That old notion that what you have and what you're stuck with, that's not true. We can make, on average, we're making about 2,000 to 3,000 new neuronal pathways a day. The unfortunate reality is that we're losing about 10,000 a day. So we have to try and bridge that gap by, bringing down the bad neuronal death and bringing up the formation. Right. So exercise is one of the best ways to make new pathways. Fasting will do it as well too. Another interesting one that we're using in our office that definitely is one of the cutting edge things is low-level laser. Low-level laser with the right dose and the right wavelength and whatnot is actually one of the most neuroprotective things that I have seen in all of my research. There's over 8,000 papers now on low-level laser therapy and intervention. So maybe we'll get into that in just a second. But back to your initial statement, the element of growing new pathways and keeping stress under control, proper dietary habits are good for that. When we eat the standard American diet, the SAD diet, that puts a lot of stress on our body. Right? The other thing about that is that's very acidic, and the brain does not like acidity. And a nice little clinical pearl for your audience on that is that that's actually where a lot of our bone density loss comes from. Is that when our brain environment is acidic because of that standard American diet, the brain will sacrifice the rest of the body to keep itself alive, so to speak. So where do you think it gets a buffer from to make that acidity more neutral? Your bones. It draws calcium from your bones, calcium bicarbonate, to buffer your bloodstream, so to bring that acidity down. So you're not going to get bone density back by taking Boniva or Fosamax or some drug like that. Right. What you want to do is twofold: get your diet and your body more alkaline. Stress reduction is part of that. And what's the second thing, Janet? What's the most important thing to make bones? Exercise. Push against the bone. Wolf's-Law. If you do resistance training, you'll make bones stronger. I don't need to belabor that point because I know you've shared that with your audience. But that's really a brain-based entity. And then we'll use other things like adaptogens and other nutrition support like ashwagandha and stuff like that for, making the adrenals work more efficiently. But then even looking at, this gets a little more complex, but your adrenals work based on an axis from the brain. It starts in the hypothalamus, and that fires to your pituitary gland, and then that controls your adrenal glands. But that axis also controls your thyroid gland, and it also controls your gonads. So ovaries and testes. So a lot of our most people aren't aware of this, but we need progesterone and estrogen and testosterone and whatnot for brain health. It's not just for libido and things like that. Right. It's for brain health. And so we have to make sure when we're dealing with brain degeneration prevention, this is why I order full sex hormone panels like FSH, LH, progesterone, estrogen. I order all that stuff in my office. Patients like, why are you looking at that? Because if you don't have those things, we have to break that cycle or support that cycle. Right. If you don't have proper thyroid, you can't turn the brain on. If you don't have proper adrenal function, and the list goes on and on. So we always look at hormones and cofactors and vitamins, because if you're missing any of the ingredients of the cake, you can't bake the cake. You may be missing the eggs, you may be missing the, whatever, and we got to make sure. And again, when doctors order just like a CBC or a CMP, they're missing so many key pieces of the puzzle of what you might be missing and not even know you're missing it. Maybe your HbA1c, your sugar levels are elevated, and you don't even know. 25% of the diabetics in this country don't even know they're diabetic. 88% of pre-diabetics don't know that they're pre-diabetic. It's scary.
Yes.
Doctor, we need to do a better job as physicians on educating our patients on this stuff.
Yes. It's a couple of things. One, back into the exercise, I see over and over the incidents where somebody will come into the gym and say they feel terrible. They're just like, and I always joke with them, well, do you want to go have a cup of coffee instead of working out? And we have a good laugh. And then we go into the gym and I start them out with something kind of easy to just warm them up. And then we just go. And at the end of the session, they say, I feel so much better. And it's like, and they've just worked really hard, even though they came in tired, and it surprises them every time. But I'm not surprised at all.
Right, exactly. And what you did was just a beautiful thing for those adrenal cortisol curves, because the cortisol curve is supposed to look like a ski slope. It's supposed to be highest in the morning, and then it's supposed to drop at night so that you can go to sleep. Because cortisol basically is inversely related to melatonin, your sleep chemical.
Right.
But a lot of us, because of our stress and poor diet habits and whatnot, we have these skewed curves where we may be low at the wrong times of day. So then you bring in that exercise and prop it up. That's the perfect time for them to exercise. But then those people may be too high at night and they can't sleep well. And sleep is going to be another topic we should touch on briefly, because that's another big thing for brain health and degeneration. But if those people are high at cortisol at night, they actually shouldn't work out at night. They should work out in the morning when that cortisol level is low and bring it up, and then use adaptogens at night to get that curve nicely back where it should be, so their sleep and wake cycles are exactly how they should be.
Yeah, you're able to balance one with the other so that it works for that person. And that explains why some people have a better workout in the morning or better in the late afternoon, for example.
Yeah, exactly. And why some people don't want to eat when they first get up and whatnot. A lot of times that's a cortisol imbalance or mistiming of that. So.
Yeah. And you said something else about, I lost my thought. It had to do with the idea of how you are able to, oh, now I've lost it.
That's okay. I talk about a lot of different things, so it's understandable. People are like, oh, I want to talk about that, talk about that.
I know.
We'll do a part 2 if we need to, Janet.
This always happens when I talk to you. Talk about sleep a little bit more. How many hours for brain health? How many hours of sleep should we have?
I love it. So sleep, the adult studies show that between 6 and 9 hours is ideal. Minimum 6, but if you start going beyond 9, then there's other issues happening, and that can actually be too much. Napping is good too, by the way, so don't underestimate that. But we actually sleep in 1.5 hour cycles. So what I tell my audience is that if the ideal sleep time would be 7.5 hours. And so that's where the hippocampus does a lot of the perseveration or memory building and things like that. I've got 2 daughters. I always tell them, if you're going to study, don't try and stay up all night studying. Study whatever you're going to do right before you go to bed, and then sleep on it. You're going to have better retention by doing that than you would by trying to pull an all-nighter. So sleep is critical, and we can't underestimate some of the common causes of sleep. Obviously apnea, where that's another good benefit of exercise, is that you're going to have less obstruction of the oropharynx. You're going to have better tone of the soft palate and things like that with exercise and some of these neuro things we talk about. You're going to have better breathing patterns, all those different things that you need to help get oxygen to your system at night. So sleep apnea is one of the things we look at. That cortisol melatonin thing is a big thing. A lot of the factors that we need to make melatonin are depleted by a lot of the medications that we take. Medications are doing a big time job of depleting methyl donors, B vitamins, magnesium, all these different things that we need for chemistry, like serotonin to melatonin. This is why a lot of our country is depressed and we can't sleep. It can be a chemical issue. So again, we as physicians need to analyze micronutrients to make sure we're not missing those cofactors.
Do you mean sleep medications or medications in general?
Well, ironically, this may sound crazy to you, but some of these medications, like antidepressants, actually deplete cofactors needed to make serotonin.
Oh.
You're like, excuse me, wait a minute. I know it sounds, but this is one of the reasons why a lot of times people on antidepressants, they do worse. They become more suicidal or things like that because they're actually depleting the cofactors that are needed. So, my job, I hate treating symptoms. I like treating the cause of symptoms. And that's really what all physicians should be doing. But unfortunately, the allopathic domain that kind of controls this country is such that, is there a pill for that? Well, unfortunately, the pills always come with side effects. I'm like, let's do diet, lifestyle. Exercise itself has been shown to be more effective for moderate depression, mild to moderate depression than any pharmaceutical ever has been.
Yes.
Get moving, get that chemistry going, get those natural opioids going, things like that. So
yes.
And we could go on about that stuff.
I know. I'm starting to understand why Bill Maher does that overtime on YouTube thing.
Right, exactly.
You want to keep talking. Well, in the couple minutes we have left, we should probably sum up some of the key things about sleep and about memory and about nutrition and what, just kind of like put it in a capsule. Can you do that? There's a lot of stuff we covered.
Well, that would be a miracle if I pull this off. But let's some main talking points that we covered tonight that I think are critical. Lower calorie and fasting, better food sources based on what Mother Nature gave us. Move, get the body moving, always learn new things, learn an instrument, fine arts, that kind of stuff. Stay socially active. That's a big thing with prevention of neurodegeneration. Stay in your church groups, your support groups, things like that. Mm-hmm. Some of the newer stuff that we're using is things like low-level laser, brain-gut health, vagal nerve stimulation for brain gut health and activation. We didn't really get into that tonight, but that's a whole other topic in and of itself. That's stuff we do in our office. Brain-based therapies. I mean, we do a lot of stuff in our office. It's based on activating the brain in different ways to keep it stimulated in certain pathways that are weak. Those types of doctors exist. We're few and far between, but we exist out there. One website I should mention is acnb.org. That's acnb.org. Okay. For all your listeners out there, those are some of the board-certified neurologists that do more of that functional neurology. Awesome. So, it's basically remembering that we're a receptor-based system and that you have to activate the system. Exercise, brain-based rehab, things like that. The take-home point, if you look at Bredesen's work out of UCLA, is that neurodegeneration is not just a death spiral. We now know with the newer research that you can either take this type of brain decline and slow it down, or we're even reversing stuff in our office. We have patients come in with many mental state exam scores of like 15 to 17, which means severe cognitive impairment. And by the time we're done with them, they're at like 25 or 26. They're remembering their families again. They can do these things. They can navigate their way home again, stuff like that. So just know that, the earlier, and this is a great finishing point, do it now. Make those lifestyle choices now. Don't wait until the degeneration gets so bad that your family members are telling you got to get to the doctor, because the earlier you do those things to prevent them, the better chance and the better outcome you'll have.
Oh, Dr. Berry, this has been so stimulating to talk about all of these ideas and so educational. I've learned things tonight, and I've been talking to you for many years, and I'm still learning from you. It's such a pleasure. And for our viewers, if you want to reach out to Dr. Berry, I will be sure his website is in the notes that came with the tag for this video, and you can get a consultation, or you can just ask a question and look at his website and get more information. So with that, I think we're going to I hate to stop, but we have to.
I'll be happy to do more work anytime, Janet. So, and thank you for having me on. It's been an honor and a privilege. So.
Thank you. I feel the same way. Thank you so much. We'll say goodbye for now.
All right. Have a good evening. Thank you.